On today's episode of Health Accelerated, brought to you by OSF HealthCare, we are taking a look back at some of the stories from the OSF newsroom that you may have missed. OSF has managed its own newsroom since 2016. There are 5 of us on the media relations team. I'm Shelli Dankoff, and joining me today for the Year in Review conversation are Colleen Reynolds, Paul Arco, Tim Ditman, and Matt Sheehan. You may have seen the names cross at various times. Now you can put the faces with them. It is a rarity that all of us get together in one place at one time because this team is dispersed throughout our 16-hospital ministry. I think we all would agree to start off with that 2023 saw a lot of growth for OSF Healthcare and exciting ways that we are looking to change the delivery of healthcare throughout our ministry. So Colleen, I am going to start with you because you support the work of our OSF Innovation and our digital health teams. And I think we all would agree that artificial intelligence, AI if you will, is making a big impact in transforming healthcare. So what are some of the key advances you have seen through this year?
First of all, I'm just going to acknowledge AI is literally everywhere now. I mean, it seemed like overnight it exploded. It is the subject matter of so many TV shows. And of course, the main theme is AI is bad. But here at OSF, we are really believing that AI can do a lot to transform healthcare and can really improve delivery and outcomes. But it is not going to replace a physician. It's not going to replace a nurse or anyone in a decision-making role. What it is doing, it is helping support that decision-making process with good data, better information than we've ever had. And so just a couple of examples of that that I think are amazing. We're using it to identify patients who are at high risk of not doing well, as they're admitted to the hospital. So we're going to watch them more closely. We're going to pay much more attention to the various symptoms that would indicate they are declining. And that AI is used to predict, okay, these are the high-risk patients, and we got to watch them more closely. So that's awesome. Also, looking at patients who are at high risk to be readmitted to the hospital. So when they're leaving, we're making sure we're not discharging them too soon. We're making sure they have a great transition plan and, that the next location they go to is the appropriate place for them. And then we're also using it to really talk about patients who are hospitalized who have a very serious life-threatening condition. That AI is checking to make sure that they have an end-of-life care plan so that we know what that patient wants. And if those discussions have not occurred, we are prioritizing those patients, not because we're concerned about their mortality necessarily, but we want to make sure that we are prepared and they are prepared just in case. So it's been great, and we've been using that to great success so far.
And some of that work, especially with the end-of-life discussions, is coming out of the work with Dr. Jonathan Handler, who is the Senior Fellow and Clinical Informaticist with OSF HealthCare through OSF Innovation. So why is his work so important for what we're doing moving forward?
Yeah, that's a great question. Dr. Handler has been one of the busiest guys in show business this year because we are really benefiting from his expertise. And one of the things that have really made his star rise on the national scene is his work with cancer nurse navigators. So these are the nurses that help the patients who have a cancer diagnosis and help them manage through the whole system. So they're doing everything from educating to getting social supports, especially if they live alone, don't have a family network, and they're also helping them schedule appointments, finding out about specialty care that they might need. Well, obviously these nurse navigators were super busy. They were getting burnt out. They were overworked. They were they loved their patients so much that they were spending a lot of their own personal time trying to help them. And Dr. Handler was brought in because, again, there's got to be a better way. And he was able to use data from electronic health records that de-identifies the patients, but has very important, markers and data, and built a large language model, as they call it, and now that's informing that workflow, and it's amazing. And they were able to test it against the random distribution that they were using, and it turns out it is a much fairer, better way of distributing that really hard work.
Yeah, Dr. Handler is so elevated. I mean, he's consulting on a presidential panel for President Biden. So, I mean, that's the level that OSF HealthCare has found itself at with some of this work we're doing through OSF Innovation. But I want to ask one final question, at least preliminarily. You hear the concerns about ethics and AI, and we're all about being ethical within healthcare. That bottom line, that is what we're all about. So how do we address those ethical concerns?
Again, this is where Dr. Handler has some really good expertise. And, just like anything, you put bad data in, bad data comes out. So one of the things he's working on with researchers that are with our academic partners, the U of I in Peoria, Chicago, Urbana-Champaign, using grant dollars, research money out of our Jump Arches, foundation. And that is really helping them look at what is the best use of data, what are the markers that need to go into developing that AI, and let's account for, were there biases that went into that? Is there a difference between rural and urban populations? So all of that. So he is very concerned. We know the pandemic showed us there is health inequity, and we are, putting up some guardrails in our own work. And then OSF Innovation has also joined a collaborative of 30 different major health systems, all working together to come up with the best guidelines, best practices and use, so that it is ethical, it is fair, and that it does equitably promote the best approaches to healthcare.
And one of the outcomes we have seen through that is the work with our diabetes patients.
Absolutely. This is a great area. We were one of the first healthcare systems to join and start using a product from Digital Diagnostics, which was an Iowa-based startup. And it is essentially an exam, a screening that can be done in a primary care office. Doesn't even have to be an eye office. We're using it because a majority of our patients with diabetes are treated in the primary care office. So they can get that screening, and within a matter of minutes, this AI-backed system can say whether patients with diabetes are at risk or have already have symptoms of diabetic retinopathy, which is the number one cause of blindness for U.S. adults. So that's pretty big. And Dr. Meeker was one of our first physician leaders to really get on board with this.
The AI can see the early changes of diabetic retinopathy that we may not be able to see with our own eyes. If the AI sees that, and then the appropriate referrals can be made.
Thanks, Colleen. A lot of impressive work taking place through the innovation and digital health world. And I think we all would agree that AI is going to be one of those ongoing topics that I have a feeling will take up a lot of your time in 2024 as well.
But that's a good thing.
Yeah, that was a good thing. 2023 was a bit of a transition year of sorts for COVID-19. It hasn't gone away, and it's now part of the regular yearly respiratory illnesses. I turn to Matt Sheehan, the newest member of the OSF HealthCare Media Relations team. You have spent a good part of the year working on, respiratory stories and taking a look at it and how we stay healthy, particularly with respiratory syncytial virus, or RSV. Let's talk a little bit about that and why that is so important.
Yeah, so I think the biggest thing that came out of this year is that after 60 years of research and data with scientists and medical professionals trying to figure out a vaccine, we finally got one. So it took 6 decades, and now it's finally here. Now, the issue that we're running with right now is rolling that out. And we saw issues with the COVID vaccine, and now we're seeing similar things with distribution with the RSV vaccine. So I think that's the biggest news of the year. As you mentioned, there are multiple respiratory illnesses and viruses that go around: flu, COVID-19, RSV. Especially with kids in school. We just got done with some holiday gatherings, and so this time of year, it's very popular. And so, we were able to speak this year and kind of see the trajectory of, hey, this is announced, this is approved, boom. Okay, next we're trying to get this approved for pregnant women because they want the antibodies to then go into their unborn babies so that they can have some protection when they are born because we know that, younger children and babies are very susceptible. And so then that was approved. And now it's, we have older adults that it's approved for, 65 and older. And so you have all these different parts of that. And again, we're seeing kind of some frustration from different healthcare systems because we have patients coming in and asking, how can I get this? And you can't yet at a lot of places. We have to direct you to this website or that website or this specific vaccine's website. And so hopefully, I'm optimistic that in 2024, we'll get some good news. That vaccine will be rolling out a little easier for those who want it. The recommendation that I've gotten from many sort of doctors is talk to your healthcare provider and see if it's right for you.
We've focused recently, at least, a lot on RSV in kids because it's a thing. Yes, the pregnant women started early, but now it's kind of the kids, and we haven't even hardly touched winter yet, and it's already rearing its ugly head. Why is that a big deal that we need to be so focused on that?
Well, I think it's, for me as a parent, and a lot of us at this table, we're parents, and people that are watching this are going to be parents, protection of our kids is of the utmost importance. And so if we can figure out ways to protect our kids, and that's why we as a team here are being proactive of talking to pediatricians. How can we keep our kids safe? So that's hand hygiene, that's, coughing into your arm, that type of thing. It's easy things that, I think we tend to lose sight of, but there are things we can do on a daily basis to protect ourselves, and not only what we can do to be, prevention beforehand, but what can we do if and when we were to get a virus like RSV.
Kids are so good at coughing into the inside of their hand.
Or not.
One other area I was going to focus on really quickly because it deals with infants all the way up to age 5 who have RSV. One of the great things about working at OSF is they innovate and they meet the moment. And they did that with RSV last season when, if you remember, we had an early start to the season. It was out of control. Hospitals were filling up. And so what they did is they turned to their OSF on-call colleagues and created a remote patient monitoring program for infants all the way to age 5 that could be monitored at home and escalated to a virtual visit, or you need to go to the emergency room if necessary. But for the most part, RSV and some other viral illnesses can be managed at home. And so that's what they did, and there were over 200 patients admitted, and that program started in December. It took them a little bit to ramp it up. Now what they're doing, which I think is just fantastic, is they've expanded that program for those infants to 5-year-old, and any respiratory illness now, they will, with a referral from a physician and a diagnosis, and you have to live in Illinois or Michigan, those are the communities we serve. If you get that, you can have your child monitored at home. What comfort and relief that would be for a parent.
Yeah, and we've heard the success stories. I mean, there's been a lot of them out there that people are so appreciative because it's not only about the sick child, it's also about how that expands out to, it trickles down to if you have to go to work or various other things like that, where if you can be at home and do that, it really is helpful. Over the course of COVID-19, we heard a lot from Dr. Doug Casper, one of our infectious disease specialists, and we've now transitioned him. So Dr. Casper's talked a lot about COVID-19, and now he's been taking a look at the RSV vaccine and how that can be beneficial and how it's different.
But this is not an mRNA vaccine, which is something we got to talk about quite commonly with COVID. This is more of a traditional vaccine in that the person is being exposed to a protein from the virus, and then they make an immune response that protects them if they were ever to be exposed to the virus. So it's much more akin to like influenza-like vaccine that most people are comfortable with.
In addition to looking back, I think we've reached the time of year where it's about Thanksgiving, it's about counting your blessings. And Tim, you've been involved in a couple of stories this year that have been about blessings. And there was one that honestly involved the majority of this team. So it shows the benefits of working for a health ministry that can connect all the dots and bring all the pieces together. So let's talk a little bit about Quentin Porter's story, because this is just amazing.
Yeah, this is just a wonderful story. He's a gentleman who lives in Mahomet, Illinois, over in the Champaign-Urbana area, and he was in need of a kidney. His kidney was failing. The way he put it was kidney or coffin. I mean, he was basically, at the end of the rope, so to speak. And so he shared his story on his social media, and his former girlfriend from high school connected with him and said, "Hey, I'll get your kidney." Obviously a shock to the system. I mean, imagine if someone from 30 to 40 years ago who you had long since moved on from came back into your life and said, "Oh, by the way, I want to save your life." That's quite the message to get. And so the story was investigated from there, and it turns out those two were not a match. And they were able to not let that, stop things. And they were able to get into what is known as the Paired Exchange Program. And that basically allowed Quentin's girlfriend to donate a kidney to someone else, and then Quentin get a kidney from someone else. And it basically makes a big X. And basically the willingness of everyone to participate allows the process to move faster, and it gets people, in this case 2 people, life-saving kidneys that they need. And so we were able to find out along the way, and Matt, you had a hand in this, that Quentin's donor was a young man from Miami, Florida, and you were able to speak to him.
Yeah, that's right. He, from connecting OSF to the Mayo Clinic in Florida, we were able to actually interview him via Zoom and put that as part of the story. And he just did it because he wanted to help somebody else.
So one of the things we were able to do, which was an incredibly emotional moment, we were able to connect Quentin to his donor, this young man in Miami. He didn't know who it was up until this point. He just knew that some benevolent person out there saved his life. And I know, Matt, you did some of the legwork on that, working through various health systems, and then you were able to speak with the donor.
Yeah, absolutely. So this is the great thing about social media, the digital age that we live in, is I think we knew early on that the Mayo Clinic was involved somehow, and we knew somehow that it was in Florida. So what did? We went to the media team at Mayo Clinic, Florida. OSF and Mayo Clinic kind of came together. They were able to talk to the donor down in Florida, and he was saying, "Yeah, I'll do this interview with OSF." So I ended up being able to set up a Zoom with him. He speaks a little bit of English, but mostly Spanish is his primary language, and Spanish is my secondary language. So we were able to do an interview in both English and Spanish, and I think Quentin, for the first time, was able to see and know who this guy is that, gave his life to help him. And the reason the donor said to me, he just wanted to help somebody. And so that's just a great story.
Yeah, just wonderful. So then I was able to take the video of your conversation, go over to Quentin's home, play it for him, and the tears were flowing.
You're sharing your life with all the people who need it, and that is beautiful.
That's pretty amazing. That young man's a miracle, and he may not have been a miracle to me, but he was going to be a miracle to someone. Yeah, that's pretty incredible. You think about your donor, but you don't really know. I mean, you can't fathom where it's going to come from. I couldn't imagine who would want to donate on my behalf to begin with, let alone a stranger. And he's not a stranger anymore. And I carry a piece of him with me forward.
Such touching moments. I mean, sometimes, I get chills just looking at it again because those are some of the daily stories we love to tell.
And Quentin himself is a character. I mean, this is a guy who has a background in acting and in radio and in media. I was over at his house and he was telling me stories about how he used to hang out with Charlie Sheen and all the things that they did that I can't repeat here. And now he's had this, momentous thing happen in his life where he was, looking at a demise, really, and he was able to be saved.
And then we connect the dots. So we've got Mahomet, Illinois, we have got Florida, and then we connect just south of Rockford, Illinois, correct?
That's right. Christy, his high school girlfriend, she lived in Rockford at the time. And again, just a very emotional story that Christy shared with us. And she said to me, she goes, some people write a book, some people run a marathon. She said, this was my gift. This is what I could give to Quentin. And it was just, you could see the tears coming down her cheeks as well. And she thought it was a small thing, but it was such an important thing. And, her piece of it was just, was remarkable. And this is something that she will carry on with her for the rest of her life as well.
And we have to give a shout out to the transplant team at OSF St. Francis Medical Center in Peoria, because that's, that did his surgery here, because that's where our transplant team is based. So paired kidney exchange, we encourage everybody to look at it and consider it, because it does connect the dots. And you never know. We're still talking about this story, and it was solidly 6-8 months ago. It was early in the year when that happened.
Definitely my favorite story of the year that I've done.
Now, you recently had another one, Tim, that
Yes.
was this also. Benevolent strangers. How many of us would be willing to do this? And so tell the story.
Yeah, so this was another story out of the Champaign-Urbana area. A gentleman by the name of Lester Lindsay, who works at a local restaurant. He was leaving work for the day, was riding home. His cousin picked him up and was riding home, and then he suddenly collapsed, went into cardiac arrest. And his cousin was trying to get first responders to come to the scene. And then a Good Samaritan just happened to be nearby. Her name is Shannon Walter. She works for the local park district. And she was experienced with CPR. She's CPR certified, and we can maybe talk about the importance of being CPR certified a little bit later. But she rushed to the scene. She performed CPR on Quentin before first responders could arrive. And in talking to everyone involved with the story, including some doctors and some EMS people, they all emphasized that that's the missing link of survival, that 5 to 10 minutes between when 911 is called and when first responders arrive. And if you have someone there that can perform CPR and can be that bridge until first responders get there with all their equipment in the ambulance, that is key in helping people survive out-of-hospital cardiac arrest, because for out-of-hospital cardiac arrest, the odds are not very high. And I hate to be all grim, but that's just the reality, is if you're in a public place, away from a medical facility, you really have to have care quickly in order to survive a major heart event. The other major part of this, you're probably asking yourself, well, how did Shannon know to get to the scene? She was across the street having lunch. She didn't know what was going on over there. There's an app, a smartphone app, which is supported by OSF in multiple markets, including in Champaign-Urbana. It's called PulsePoint. And basically what that does is it gives you CPR alerts when someone nearby needs CPR. And so that's how Shannon was alerted. She got a ping on her phone saying, hey, just across the street, a few hundred yards away, someone needs CPR. And so that's kind of the other peg to this is, you should look into learning CPR, getting CPR certified, but you should also check out this app as well, which again, it's a nationwide app, but locally within markets, it's supported by OSF. And it allows you to not only, follow first responder calls, but the big thing is to turn on alerts, just like you would get an alert on your phone from, a social media app. You can turn on alerts that notify you when someone nearby needs CPR, and you can be a lifesaver.
The other great part of that app, and I've known people who survived because of it, is it also identifies where defibrillators are if you're in a certain building. And this is really important holiday time. Lots of people are under stress, and if you are out shopping or if you are someplace, make sure you have that Pulse Point app downloaded on your phone. And because if you can help someone by just, if somebody goes down, maybe you don't know CPR, but maybe you can help find that defibrillator and get it there.
Get it there.
Yeah.
So I think that is just so important. Even if you're never going to learn CPR, you can at least help in that way.
I think just listening to this conversation and these stories reminds us, I think all of us on a daily basis have these stories and these touch points that stick with us, and they remind us of the blessings throughout the year. But these are the stories that we love to tell because, again, the gift of strangers out there that are helping.
And I'll just add that Lester's doing well, and just recently we were able to reunite everyone who was involved in that rescue. So Lester and Shannon were able to meet each other for the first time. We had the ambulance crew there, the fire crew, and it was a wonderful event. Everyone's doing well.
That is the ultimate best news
Absolutely.
at the end of it, yes. So we're going to switch gears a little bit. Paul, you took, coming out of that, you took a look at hospice care. And so many people think of hospice care as end of life. Colleen touched on that. We talk about end of life care. But in reality, hospice care really, think Jimmy Carter. Jimmy Carter went into hospice care in February and is still with us as of the recording of this. But hospice care is about improving and the comfort of life and moving forward. So you did a story on hospice care in our hospice care program that really meant a lot to you.
Yeah, it did, Shelli. And it started with President Carter. I mean, back in February, he entered hospice, and the assumption on so many people's part was this is an end-of-life situation. 9 months later, here he is, still in hospice, still under care. And the goal remains the same, to keep him comfortable and to enjoy the time that he has remaining. And, there are no assumptions about getting healthy. His time is coming to a close, but they have been able to provide him comfort and care, and he's been able to enjoy the life that he has left at home. And his wife entered hospice recently, too. Unfortunately, she did pass away recently. But, the average length of stay in hospice is about 90 days. But some people don't make 90 days. Some people live a lot longer, like President Carter. So, you just don't know. But it's been around for a long time. It started in England in 1967, came to the United States in the mid-'70s. And so it's been around a long time. But there are 3,200 programs in the country, and there are 1 million people that are in hospice. And it's such a benefit, not only for the patient, but it's a benefit to the family, and it gives them the peace of mind that their family member is being taken care of.
And honestly, our providers wish more people knew about this program or would at least take advantage of it. Because it is a tough conversation to have, let's be honest.
Yeah.
It's a hard conversation to have. But the providers you spoke with wish more people knew about this and took advantage of it, right?
Right. I interviewed Dr. Sarah Whalen. She's the medical director for OSF Hospice in Rockford, and she gives some great tips. One is ask for referrals. Ask your friends, ask your family, ask the hospital, for some referrals. Ask questions about the services that they provide, pain management or whatever the case may be. But the care team is more than just a doctor and a nurse. There's an entire care team that will provide the care for your loved one. And then make sure that you're comfortable with your decision, and also make sure that your loved one is comfortable with this decision as well. So, again, I can't stress the importance of how, it really benefits the entire family. And, it's making a difference for these families each and every day. And the impact, I did a story in Escanaba as well about another family that benefited from the services of OSF in Escanaba. And it's the same thing. This family said to me, we could not have gotten through this ordeal without the love and the support from the staff at OSF Hospice. And that support continues to this day. Their father passed away a couple years ago, but they still keep tabs on this family. So that care, that love, and that support really never goes away.
So the conversation with the providers, as Dr. Whalen says, is so important.
I don't know, there's more than just medical stuff at the end of life. There's a lot of spiritual and social and family things that people need to work through, and I think hospice does a really good job of helping people prepare for the end of their life and to help write that last chapter the way that they want to.
Okay, as we move along, before we wrap things up here, as we're looking back to all of you, what most surprised you in the areas you support or the healthcare coverage that we did over the past year? What was the biggest surprise?
I'll join in with the AI theme, and that was how quickly AI became the biggest thing dominating media. It seemed like it started maybe 6 months ago, and almost like overnight, all of a sudden, I had never heard of ChatGPT or Bard or any of that, or Dolly, and all of a sudden, this is becoming like a household name. And so it just, the speed at which all of a sudden that just took off just blew me away. And I guess what I'm really looking forward to in 2024 is, where is that going to take us? Because I think I, like a lot of people here at OSF, do believe it has the power, just the computational power, to use data in such a meaningful way. I think we could just help so many more people in such a big way. I think we can improve access, outcomes, equity, all of it. And I think that is just like, it's one of the most exciting times in healthcare, really.
But we've also on this team had the discussion about how it will affect what we do too.
It will.
And we've all having conversations about it because everybody's like, "Oh, is ChatGPT writing your stories? Are they doing stuff?" And we all go kicking and screaming. We all know that, but it can be a benefit and it can provide some help, and we all know that. So it is a conversation for the media relations team to have moving forward of how we manage that. And then to our listeners and viewers, what do you believe? You know, so it has to be. That's another big conversation around AI because it pulls in from different data points and where its source is coming from, because we've seen that it's not always 100% accurate.
And
so
transparency is interesting because some publications began by disclosing that this article was written by, AI. They're not doing that anymore. Which scares me a little bit. But as we've all learned from trial and error, you can tell the difference. And if you're relying on generative AI, just the surface stuff for, good information, you better be careful. You better double check and vet everything because it is not all it's cracked up to be, at least not yet.
Okay, Paul, biggest surprise and the biggest thing looking forward.
I don't know if that it's a surprise, but I've done a lot of work with our colleges of nursing this year, and we welcomed our new president, Dr. Charlene Aaron, to OSF, and she has just taken off running. She's got great ideas, great experience, and the times I've had the opportunity to chat with her, she wants to get more into the high schools to start recruiting students. She wants to create more of a mentorship program. She wants to get more men in the field of nursing. And so you're going to see exciting things happening with our colleges of nursing, both in Peoria and Rockford. And that's exciting to be on the same page with her and to tell those stories. One thing I just did recently with them is a telehealth medicine program that they've started in Rockford. And so now they are teaching telehealth to their nursing students, and they are learning things they never would have thought would be part of their curriculum before COVID, but now it's a game changer, and they're going to do telehealth and a whole lot of other things. And the thing quickly that I'm looking forward to is just all the programs, the new services, and the new providers that we have as well. I mean, there are so many people with great experience, great stories. We have patient testimonials coming down the pike, and we're making a difference each and every day, and it's just really exciting to be one of the storytellers telling those stories.
Tim.
Well, I'll just say, not to piggyback off Paul, but it wasn't so much a surprise, but just everything I've learned over this past year about healthcare, about what OSF is doing. I mean, if I look back at my files and say all of the stories that I've written this year, it's been everything from stories about exercise to stories about pregnancy. I even did a story about why you shouldn't pick your nose excessively. I mean, just anything
That's
and
important,
everything.
you know.
And I'm a storyteller at heart, so I love telling those stories. So that's been the most fulfilling for me this year, is to get to tell those stories. And then kind of continuing that theme moving forward. What I'm most looking forward to is continuing to tell those stories. In particular, what Paul just said, our patient success stories. I love getting to sit down with those people who are kind enough and open enough to share their stories with me, and what might have been a traumatic time of their life, but they're willing to share it publicly so that they can help others. Later this week, I'm going to sit down with one of our cancer patients who is an older adult, and he's a bull rider. He is continuing to ride bulls.
B-U-L-L, bull
yes,
rider.
like the animal.
Okay.
And
All
he's
right.
continuing to do that while he's getting chemo. I mean, what an incredible story.
Okay, I can't wait to see this guy.
Can't
This
top
is-
that.
Sorry,
Sorry.
I'm just going to say, we write bull something. No, just kidding. No, that'll be fascinating.
Yeah.
But you're right. Those are the things and the advances that we're making, because 15, 20 years ago, that might not have been the case.
Right.
All right, I'm going to go to the new kid on the block over here.
Yes.
And Matt Sheehan. So you made the transition from a media world into the PR world. And so I'll ask you, what has been the biggest surprises over the years, and then looking forward? Because you had to hit the ground running hard early in the year.
Yeah, I came over from doing TV for 5 years to joining you all in February, and so it was an interesting time. I have to go back, we're talking about surprises, and I don't know if it's so much of a surprise, more of just becoming refreshed of, honestly, COVID and where we've came from and where we've gone. I mean, I got married in 2021, COVID time, masks were worn and certain things. We're worried about the numbers of who could come to the ceremony and all this stuff because of regulations. We had our first child during COVID, so that was another, thing there going on. But then this year, what we've seen, so much growth, and I mean, I feel refreshed to be able to travel and be able to kind of live life more freely. So that's been kind of my surprise, because I feel like I was getting in a rut, and I think a lot of people were is this ever going to end? The shutdowns, the lockdowns, the mask wearing and stuff. And I mean, people are still doing that and a little bit, and that's fine. It's their choice. But I just feel like that was my big, okay, I feel good about where we're going. When it comes to looking forward to next year, and I hope I'm not stealing from you, Shelli, but it has to be the OSF Cancer Institute here in Peoria. And so I'm sure, if you want to talk about it more later, I mean, that's kind of your thing. But I just feel like that is going to be such a regional attraction, and that high quality life-saving care is going to be offered right here in Peoria, which is going to be fantastic. And not only that, but we're seeing it in some of the other markets that I support. Galesburg is getting some new services that are going to be very much needed in that market here for the coming years as well. So I think it's just OSF's approach to cancer services and the high quality life-saving care.
Well, we're going to end on that because, yes, there will be much more to come on the OSF Cancer Institute that will be opening in February. We're very excited about that. Yes, there will be full podcasts on that coming forward, so we won't go into that today. But this has been a great conversation. Colleen, Paul, Tim, Matt, couldn't ask for a better team to help tell the stories. We will continue to tell the stories into 2024, and we look forward to bringing everyone else along with us on that journey. Thank you for joining us for this edition of Health Accelerated, brought to you by OSF HealthCare. Listen and subscribe on your favorite podcast app. You can also find links to any of our episodes at osfinnovation.org/healthaccelerated.